Medication Errors in the Healthcare Setting by Karen Baker, Brittany Cox, Kyle Brain, Casey Birchfield, Michaela Allen, and Max Chesser.
This is Kyle Brain speaking, and I have the intro slide. And the purpose of the presentation is the topic of medication errors and how we can lessen the occurrences of them in healthcare by using informatics as the solution. As a nurse, we are called to put the patient before ourselves. This means we need to keep them safe in any given circumstance or event. So what is a quality dashboard? A quality dashboard is used to communicate information throughout an organization and can be personalized to show specific data information that you feel is most important. For our case in medication errors, it is used by using red or green colors showing instant feedback as well. If the indicator is green, it is complete. If not complete, then it would be red. And this quote right here is a quote from my source. And executives, managers, and clinicians within hospitals and healthcare systems rely on dashboards to provide critical information to inform data-driven decisions without sacrificing data privacy. What is a quality indicator? A quality indicator includes pain management, patient satisfaction with the education they receive. Each indicator is specific to the individual patient. For medications, it would show the 6 rights of a medication patch. It would also show the precaution/rules to avoid medication errors, and it's just used for like a wristband when you're scanning and allergies and stuff like that. How is a dashboard used in nursing at an organizational level and at a unit level? A dashboard is used for a healthcare organization, for example, key performance indicator and goals. Is also used for patient perception, for example, patient experiences, ease of stay, wait times, etc. Another type is clinician dashboard, and this allows the nurse manager to see what is exactly happening on the floor and how each department in the hospital is managing its demands. The last one is the donation dashboard, which shows funds, donors, donation directives, and how is data collected. Data is collected by summarizing the most important information and the information that needs immediate attention. The data collected is presented visually and can be viewed easily for anyone who has the right to look at it.
Hi, I'm Caitlin Adams, and I'm talking about the individual indicator. When studying medical error, it is often evaluated by a ratio instead of by a quarter. Most institutes do not share records, so it is hard to gather an exact number, but through research of several institutes, we can get an idea. A study of 36 institutes found that although there was a 19% medication error in dosage, only 7% of those resulted in adverse effects. It has been estimated by the Institute of Medicine that medication error causes 1 of 131 outpatient and 1 of 854 outpatient deaths. It is important to measure this indicator because medication error is something that is very serious and can be easily prevented with proper procedure and education. Medication error is often caused by a simple mistake, like getting distracted or interrupted during MedPass or not checking the 5 rights at least 3 times when giving medications. Both of these things can be easily fixed or avoided with proper planning and education. This needs to be addressed due to how many patients it affects and how easy it should be to decrease or eliminate medication error with education and following proper procedures. CMS measures and reimbursements are not an issue due to the fact that depending on where in the process of medication administration the medication error occurs determines whether or not it is the nurse or the physician who suffers legal consequences. But the CMS isn't considered part of the problem unless there are technical difficulties.
My name is Max Chesser, and I will be discussing investigating the problem of medication errors. So first of all, in order to better understand and combat the occurrence of medication errors, it's important to realize the specific reasons for medication errors. Many studies have been done trying to figure out the reasons for medication errors, and most of them ask nurses. The first study I'm going to be discussing involved a questionnaire being given to registered nurses, and 76.4% of the nurses believed that there was more than one factor contributing to medication errors. 86.1% of the nurses believed that personal neglect was a main factor in medication errors. An example of this would be neglecting to follow the rights of medication administration. 37.5% of the nurses believed that heavy workload caused by understaffing was a main contributing factor. And then another 37.5% of nurses believed that new staff that were inexperienced were a main factor in medication errors. With this study, they believed most of the problems were caused by personal issues rather than facility issues. In another study involving nurses, the top causes of medication errors included the packaging of medications being similar to other ones, physicians' medication orders not being legible or clear, nurses getting pulled in between teams and from other units that they're not used to, the names of medications being similar to others, the use of abbreviations instead of the full medication order being written out, unit staffing being inadequate, and many patients being on the same or similar medications. So a lot of these were due to poor communication.
Hello, my name is Michaela Allen, and I did my slide on addressing the defects. Automated dispensing systems and barcode technology is being used to decrease medication errors in healthcare facilities. Automated dispensing systems have helped reduce dispensing errors by 31% through packing and barcoding of medications. Barcoded medication administration systems have been linked to a reduction in medication errors of 54 to 87%. On-site pharmacy dispensing medications can also help lower medication errors. Maintaining adequate staffing of nurses and pharmacists, especially on the weekends, will help prevent healthcare workers from making shortcuts and reduce medication errors also. Adequate training of the pharmacy technician and working with pharmaceutical companies to reduce look-alike drug packaging also can play a big role in helping the reduction of medication errors. The use of these machines help prevent medication errors by adding in factors such as pop-ups that tell you when scanning a drug if it is wrong. All hospitalized patients are given a bracelet to wear with a barcode that matches the medications they're taking. For most barcode scanning machines, a big red warning sign will pop up, or it will prompt you to stop and will not let you progress with the medication if it is wrong. The rights to medication administration include right patient, right drug, right time, right route, and right dose are a critical protocol that must be performed to help prevent medication errors. Another protocol that has been implicated is the right for the nurses, which includes the right to a complete and clearly written order that includes correct drug, route, and dose dispensed by pharmacies. The right to have access to drug information, the right to have policies to safe drug administration, the right to administer drugs safely and to identify problems in the systems, and the right to stop, think, and be vigilant during drug administration. Following these protocols, along with better staffing and less distraction, can help reduce medication errors in the healthcare facilities.
This is Casey Birchfield, and I did the application to the EHR client. So looking at the use of the electronic health record, 92% of patients were happy with their doctor e-prescribing the medications versus their paper prescriptions. 76% reported it made obtaining medications easier from the pharmacy and that they didn't have to wait on their medications when they did get to the pharmacy. And 63% reported fewer medication errors. The use of electronic health records can reduce errors by keeping an up-to-date record of patients' allergies and medications and automatically checking for problems when a new medication is prescribed. Information gathered by other providers are accessible to emergency providers and other doctors to alert them of any life-threatening situations that the client might have, improving the safety of the patient. Most electronic health record programs provide clinical alerts and reminders also to prevent errors. Certified electronic health records may help providers prevent liability actions and errors by demonstrating adherence to the best evidence-based practices, producing complete, legible records readily available for the defense if errors were to occur, and disclosing evidence that suggests informed consent.
This is Brittany Cox, and I will be talking about medication errors in the healthcare setting and the role of the BSN nurse. The role of the BSN is administering the medication itself. It is the responsibility of the nurse to verify the MAR 3 times, as well as properly identify the patient using 2 forms of identification. Failure to practice the 6 rights of medication administration results in medication error. The nurse should be held accountable if the 6 rights in MAR were not checked according to policy. To avoid medication errors, a positive change in procedure could be education and even re-education of the importance of following protocol and procedure to avoid medication errors, and proper navigation of the EHR in whatever system the facility uses. It is also important that proper procedure be in place for the nurse to ensure a medication error doesn't occur. For example, an error message popping up in the EHR when the nurse scans the armband of the patient that this is not the correct patient. Some ways to avoid medication errors by the nurse are practicing the 6 rights of medication administration, properly being able to navigate the electronic health record, verifying patient identity using 2 forms, verifying allergies on the chart and verbally, maintaining drug references, know the do not use abbreviations, ensure knowledge and proper navigation of the technology being used for the EHR. Technology has come a long way in ensuring the reduction of medication errors. It is the nurse's responsibility to ensure that they can properly navigate the electronic health record and be current on the policy and procedure of the facility. Being educated on informatics and technology, the nurse can reduce the risk of medication error. The EHR being able to record everything that the patient undergoes in the hospital setting will help research better their chances of reducing medication errors.
This is Karen Baker. What is the role of informatics and the implication in patient care and outcomes? Multiple research studies have proven that informatics have been vital in reducing medication errors and other errors that may be found in healthcare settings. Healthcare systems that use computerized provider order entry and clinical decision support systems, along with electronic health records, are more effective in reducing errors, specifically medication errors. Reduced medication errors imply positive patient experience and health outcome. How can informatics be used? Informatics can be used in improving quality outcomes by integrating nursing science, computer and information science, which means technology and analytics, data mining, and development of systems for documentation and monitoring and quality improvement. All of these things are used to identify, collect, process, and manage data to support best nursing practice. How does data mining apply to this? Data mining can be used to establish relationships between certain occurrences, such as patients that are at high risk for falls, or patients that may not be compliant with medications when they return to the community, and other factors. Data mining can analyze and predict outcomes and assist with development of clinical decision support systems. What are the recommendations for medication administration reduction in errors? Human errors may still occur, but having an electronic medication dispensing, monitoring, and documenting system, along with clinical decision support systems and an electronic health record in place, can significantly lower the risk of human error and improve quality and patient outcomes.
This is Brittany Cox, and I will be summarizing our presentation. The role of performance measures is to see how an organization is doing and how to make improvements in the future to improve or learn from. The overall goal is to improve the performance for everyone involved in the organization. For example, to make it safer or increase quality of care. In our case, in medication errors, it is crucial to look at causes and effects of medication errors that have taken place in each company/organization and eliminate them. The role of performance can show healthcare where exactly they need to improve and lessen/eliminate medication errors. The role of performance measures is used as a self-evaluation and shows your successes and failures as a whole and is essential in growing an organization. Observing for performance deficit is important in medication error because it is usually a simple mistake or overlook that can make all the difference and in the long run save a patient a lot of pain and trouble or even save their life. Using the best practices like not getting interrupted during MedPass, checking the 5 rights at least 3 times, and knowing the correct abbreviations to use during documentation can greatly improve the deficit when seen in both hospitals and home health. Many hospitals and other healthcare facilities do not have enough money or are not willing to pay for adequate staffing in their facilities. This leads to an increased workload for employees, and many will take shortcuts so they are able to get their job completed. The cause of many medication errors has been linked to inadequate staffing and an increased workload of nurses.